Hi there, students. So I'm going to show you how to do your case of the day. We're talking about your AuntMinnie assignments that are going to be listed under your assignments tab. So this is your pathology class. Go to your assignments tab and you'll see you have different AuntMinnie cases. I'm going to show you how you can go about getting these done so you can get full credit. So first week that you guys are going to be doing is just miscellaneous. You can pick whatever you want, so whatever pathology strikes you as interesting, so go ahead and pick on that. And as you can see, as we go through the pathologies throughout the system, you'll see that we're going to be doing, you're going to find a pathology of the esophagus, stomach, or small bowel, then we're going to go into the colon, and then you've got liver, gallbladder, pancreas. Now on the liver, gallbladder, and pancreas, it might be easier to find something listed under ultrasound, and I'll show you what I'm talking about. So we're going to go through, these are all timed releases, so you can't start and do them all at the same time. So you need to do it as we go through the pathologies. So you see them all here, so what you're going to do is you're going to go ahead and you're going to click on AuntMinnie.com, so www.AuntMinnie.com. And this is the home page. If you haven't signed up and got an account, you need to do that. So sign up, get an account, and then you're going to go to this little tab here. It says Case of the Day. So you are going to click on Recent Cases, Case of the Day, whatever you want to look at, or you can come up here, which I find easier. You can just go under Cases. If you want to submit a case, you can do Create a Case. You can submit whatever you like. These cases are unique. They are not stuff you see every day, and it's in a radiologist site. So you will be guessing what the pathology is and what the abnormality is within CT, ultrasound, nuke med, MRI, X-ray, so you have all the different modalities. So it's really good for you to see the different modalities and see the pathologies on what it looks like. So you're going to try to guess. Now I don't expect you to get any right. Towards the end of the semester you might be able to get a couple right, and that's pretty cool. So like I said, don't expect to get them right. This is more of a learning tool. So you can go into Case of the Day Archive. That's usually what I go under, and List View Classic. If you know that there's a good case in a certain month, you can go to it. Try not to pick the first case every time listed under whatever pathology you're looking at, because I see it 10 times, 15 times. So I don't like reading the same cases all the time. So you can go ahead and over here under your modalities, if you want to look under cardiac cath lab for any cool heart cases, CT for any kind of ortho or any kind of specialty. I'll show you what I'm talking about. Here's fluoroscopy, so you'll go under fluoro and you will look at cases under fluoro. So as you can see, 32-year-old man with progressive dysphagia. So you can also come down and we can focus on the different areas. So you can say, I want fluoro and I want to cover gastrointestinal. There's urinary, there's all different areas. So 13-day-old female with abdomen distension and poor feeding over the past 2 days. So you can click on it and say, okay, that one interests me. Try not to pick the first one. I don't like reading the same ones every time. Try to pick something different. So here it's telling you, 13-day-old female newborn presents with abdomen distension and poor feeding for the last 2 days. She was born prematurely at 35 weeks. Frontal and left lateral decube. View radiographs of the abdomen and pelvis are shown below. So you can click on them and you can look at them and say, ooh, that's a lot of gas, huh? So, okay, we're going to close that. And let's see, the imaging findings are suggestive of possible bowel obstruction. Well, looking at the image, I can say, I don't see any gas patterns down low. So, there is a chance that there is a bowel obstruction. So, why not? We'll bite. We'll say, okay, let's just hit it. True? Oh, we're right. Good. So, we can go to the second one. There's usually 5, and then it says additional images. Great. The abdomen radiographs were concerning for distal bowel obstruction without evidence of pneumatosis or pneumoperitoneum. I'm saying that backwards. The barium enema was ordered for further characterization. So, multiple spot images from the barium enema are shown. Click to enlarge. So, looking at them, it's like, this one This one looks interesting. So you can see we've got a redundant colon. It's spiral. It's interesting. We have interesting pattern there. Doesn't look quite normal. Looks a little strictured here. So let's see what they have to say. Based on the clinical history and images provided, what is the most likely diagnosis? So if we look at megacolon, yeah, maybe Hirschsprung's, maybe intestinal malrotation. I'm going to go with that one. There's necrotizing enterocolitis. It doesn't look like I see sores, so let's try that one. Oh, I'm wrong. So it's Hirschsprung's. So you're going to learn all about Hirschsprung's disease, and you're going to try to guess. The normal rectum to sigmoid colon ratio is less than 1. Normal, I don't know what that is, so we'll say true. Nope, false. So, see, some of this stuff I don't even know what they're talking about. So let's take a look. The findings and diagnosis. So here you go. You can read about the abdomen. You can read about the barium enema and what it's saying. So your differential diagnosis is Hirschsprung's, congenital, hypogangliosinosis, congenital megacolon. You've got intestinal neuronal dysplasia, and internal anal sphincter achalasia. Interesting. So go ahead and look at this. Additional questions. What portion of the intestinal tract is most commonly affected by Hirschsprung's? So it is the rectal sigmoid. What is the most common age of presentation for Hirschsprung's disease? I'm going to say it's less than a year. And which of the following pathological findings is most consistent with Hirschsprung's? Presence of ganglion cells, submucosal, or absence of ganglion? There you go. So, as we go through the pathological conditions, you are going to learn all about that. So you'll be able to answer those questions. So then it gives you your key points. So Hirschsprung's disease, the pathophysiology, the epidemiology, the clinical presentation, imaging features, differential diagnoses, the diagnosis. So they had to do a biopsy on this patient in order to prove the results. Then they talk about treatment. So I kind of want to know what we do. So usually it's surgical. The goal of surgery is to remove the part of the bowel that's not reacting. So just put it in your own words. You can look it up on WebMD also to find out, or another good resource is to actually look at the references that they use, and you can look up where they got their information and you can use them. So that's how you do an AuntMinnie case. So you're just going to go back in and you're going to click on it, and you are going to post. You're going to write a submission. Don't put it in comments because it populates for me really, really small and it's hard to read. So if you do write submission, you post it in there. So that way I'm not reading this little teeny print far off to the side of my image. So click on write submission, put in your own words exactly what you found and what you learned. Okay? So that's how you do it. You just hit submit when you're done. So that's how you do AuntMinnie. You're going to be doing it every week, so you'll get really savvy with it. So try not to pick the same cases as your friends, only because I get really bored reading the same ones every time. Okay?